Really blowing around out there. Okay, I have 1:15 straight up, so we will go ahead and get going. Welcome everybody to our media briefing regarding all things COVID-19 in the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will begin with opening statements, first of all with Mayor John Hamilton.
Thanks a lot, everybody. Good to be with you. These are challenging weeks. Just reporting on the city side, we are continuing our vaccination and boosting encouragements and programs and our regular testing of unvaccinated employees. As an employer, we have, just to note, we've identified several positive cases through that testing program. So it is working to help protect our workers and our workplace. As of January 19th, the most recent full data, the percent of all of our active employees, including temporary employees who are vaccinated, is 70%. That's up 4 percentage points from early January. And the percent of all our regular active employees, not including temporaries, is 71%. That's up 2 percentage points from early January. However, just this week, yesterday, we reported 30 positive cases among our employees, positive tests for COVID, and 38 last week. That's 102 for the month. And I may ask Andrew to share that graph if you can. This is from the beginning of our employee positive testing from March 2020. In January, that bar should actually be about 30% higher. It now goes over 100. We just haven't entered that on our Be Clear database yet. But you can see we've really had a steep rise in employee cases, almost all community spread from all that we can tell, but just as a visual indicator of what we're seeing as an employer, and I know that's not unique. Thank you, Andrew, for that. I'll just mention that we're continuing to do all we can. That's basically 1 out of 8 of our employees tested positive over this past month, which is kind of a striking number. Most are not sick, but that's significant. On the utility front, I also just wanted to note, for those of you who followed this last time we reported the wastewater numbers, we indicated they were probably significantly affected by the dilution of significant precipitation during that period. This most recent week, last week, actually, we set new records again in the pandemic for the gene copies identified in the wastewater. 7,200 gene copies at Blucher Pool. That's twice as high as it ever has been this past week, and 4,800 at Dillman, which was almost as high as it's ever been in the pandemic identified at Dillman. So that's pretty striking. Again, this is not entirely vetted scientific numbers. It's part of the cutting edge of trying to find early indicators. This week, they actually did come down a bit from that 7,200. It came down all the way to 1,200, and the 4,800 at Dillman is down to 770 this week. So those are significant reductions, which we don't know, but at least we'll take as an indicator of what we may hope be happening. We know the state is all in red. Every county, the hospitals are full and struggling. We very much must continue to try to flatten the curve, help our healthcare system out with vaccinations and boosting, with masking, with not sharing air. And I guess I will say I'm hanging on to the hope that maybe those early indicators and some others suggest we may get out of the Omicron surge in the coming weeks. We hope that, but in the meantime, we really need to stay steady and keep doing those things that protect us. I want to thank all the city workers who are doing really extra duty to try to make sure we keep the services going with the positive cases that we've had. And we're hopeful that that will diminish just a bit as it has this week, and as those wastewater numbers maybe give us some indication for. So back to you, Chuck. Thanks.
Okay, thanks very much. Let's go to the Monroe County Department of Health and Penny Caudill.
Good afternoon. We've had several opportunities this week for vaccinations and for testing, so that is where I want to start. Tomorrow, we have a clinic scheduled that was originally a school booster clinic. It will be located at Bloomington High School South Cafeteria. The clinic runs from 9 to 12, and it's Pfizer vaccine. But that clinic has now been opened up to anybody who is eligible. So if you are needing your first dose, your second dose, your booster dose, they have Pfizer vaccine at that clinic, and it is now open to everybody because we simply didn't have all of those appointments filled. So happy to say that if you need Pfizer vaccine on Saturday, we can accommodate you with that. Tomorrow, today and tomorrow, I think IU is hosting a Moderna clinic. I know Kirk White will give us more details on that. Today and tomorrow, the Indiana Department of Health and mobile clinic is still open at Sherwood Oaks Church. Pfizer and Moderna vaccine is available for anybody who's 5 and up, so they can accommodate you if you are 5 and over. This is an indoor clinic. However, the lines may extend outside at times, so please dress for the weather. You know, it's cold and snowy today. So if you are going there, please just make sure you're dressed in case your line is outside for a little bit. Appointments and full registration are preferred for all of these clinics when people are not only scheduled with their appointment, but they have fully completed their registration. The process is really extremely quick. It is filling out and completing the registration that really is what slows things. So the more you can do ahead of time, the faster those lines will move. Visit ourshot.in.gov for all the locations for vaccinations, or call 211 for assistance. The mobile clinic at Sherwood Oaks is also doing PCR testing. So if you need a test, you can get that. We have had great feedback today and yesterday from people who have went to the site and said it's running very smoothly. So we always love getting good feedback about any of the sites and things that we have going on in town. Visit coronavirus.in.gov to find out about all your testing sites. The Indiana Department of Health Gravity site remains open on Curry Pike. They are open Tuesday through Saturday, 8 to 4. They provide PCR testing. No appointment is needed. It's a drive-through clinic. And we did get some new information from them today that I want to share. They are in the process of moving away from paper forms and utilizing mobile registration for testing. So I talked to you a little bit, I think last week or the week before, about the QR code that they're using, but they're really moving away from paper. So if you have a smartphone, access to email on your phone, then you can register on site, and they'll be able to pre-register as well, and then present the QR code or your order number to staff when you arrive. So you can kind of do all of that on your way there. If somebody else is driving, you could, somebody else could register everybody. For patients, they feel like this is going to be a benefit not only to patients, but for staff. But the pre-registration for the patient will just make things go much more fast. The results will be sent to the correct email. You won't be relying on somebody else entering that email. You're going to do that to ensure that you get it, that it's entered correctly. If you test again, you can just go back into that app and renew that process and get a new code for that. They will continue to have paper for people who need it or want it, but it will also mean a quicker turnaround time for your results. We also know that people are starting to receive their free at-home tests from the federal government. If you ordered those, I know those are starting to come. That program was launched earlier this month, 4 tests per household. You can order yours through covidtest.gov, and remember, it takes about 7 to 12 days to get your kit. The federal mask distribution program has started as well, and so pharmacies who are part of that federal program will have masks, 3 per person, to give away if you need those higher end masks. They will not be coming to local health departments or state health departments, just through those pharmacies. We do have some flyers that we have posted on social media and through our partners that are both in English and Spanish to give information about both of those programs. So follow us on Facebook and you can share those flyers and that information as well. The mayor did mention we remain in a red advisory. Our cases per 100,000 did decrease slightly this week. Our positivity rate rose slightly this week. So at the moment, we're kind of watching this potential plateau. And like the mayor, we're hoping that that's a sign of better things to come. But we will continue to watch that and see what happens. It's too early to say at this point. We can make that happen, however, by following proper precautions and responsive actions. Vaccine and boosters do remain our biggest and best defense. Recently published studies in the MMWR and JAMA have reported some data on risks, and I want to share a little bit of that with you today. We've got a couple slides that we just want to show. And you can go to the COVID data tracker and you can look at this information and dig deeper into it. But this is from a study from April through December, and it compares rates of COVID cases in vaccinated and the unvaccinated. So you can see that, yes, we are seeing breakthrough infections, but the risk of testing positive was 4 times higher in the unvaccinated, and the risk of dying was 15 times higher during this period of time in this study. The next slide is from August to December, and it compares vaccination status with a booster included in there. So again, you can see the vast difference and how much greater your risk is when you are not up to date on your vaccines and the difference that the booster can make. So yes, we're seeing changes and we're seeing breakthrough cases. And the next slide kind of puts this together. So you can see that the vast difference and your increased risk when you are not up to date. So I would encourage you to look at that, look at the data. You can read the report for yourself, but these are good illustrations of why you may see people that people in your circle who are vaccinated, who may even be boosted, but they're still getting infected. We know, we've talked about breakthrough cases and reinfections. We know they occur, but they are still a much lower number than those of people who are unvaccinated or not up to date. So when you look at hospitalizations and death, the risk of those with vaccination is much better. Things to continue to change as more is learned, as circumstances unfold, things will continue to change. And these past 2 years have been nothing if not consistent change, right? One thing has not changed, and that is that we all have to individually and collectively do everything we can in order to meet this challenge. So I just say, let's keep fighting. We can get through this if we do it together. Back to you, Chuck.
Okay, let's check in with the Monroe County Board of Commissioners and Julie Thomas.
Good afternoon, everyone. Thank you all for being here today. The Board of Commissioners want to start with a note of appreciation today, gratitude for all of our healthcare workers across our county and the state and the country, but also for our county's health department, our board and leadership and staff. You've all just been amazing. We are really excited with the way that all of this has transpired in terms of providing these and organizing these clinics, working with IU and our health department and getting all of these together. It's no easy feat. They make it look easy, but it's not. We're really grateful for that. And you will find information about things like that on our resident alert. Go to co.monroe.in.us. On our homepage, go to the megaphone, and you can set up how you wish to receive alerts. All of these clinics have been part of our alert system, and just about 10 minutes ago, we got our alert that we're in a yellow travel advisory as well, which means just be cautious on those roads. We do have, we're working with the Red Cross to provide blood drives, and the next ones that are coming up are on Monday, January 31st, 10 a.m. to 3 at Ivy Tech, and Wednesday, February 2nd, 1 to 6 p.m. at Ivy Tech. And a big thank you to Ivy Tech for hosting for us. There is a blood shortage, so it's really important. If you can give, please do so. And a reminder as well that we do continue to have a Township Assistance Fund available for our county residents. It's for anybody who's dealing with financial impact and are struggling to meet their basic necessities. About $200,000 has gone into this fund, and it's administered by our township trustees. If you don't know who your trustee is, go to call 211 or go to in211.org to find out. Everyone who lives in the county lives in one of our townships, so whether you live in the city, a town, or neither. So please contact your trustee if you need assistance. They also have other means available to help you out and get you through this time. And just a reminder to everyone, and a thank you to those who are vaccinated and boosted, and those who mask up to protect themselves, their families, the loved ones, and most importantly, others in the community. It's really important that we keep this up. Thanks, everyone. Take questions.
Okay, so next check in with IU Health and Brian Shockney.
Good afternoon, everyone, and thank you for joining us again this week. Unfortunately, as you can see on the screen, we continue to see a high COVID-19 census across the South Central region at IU Health. As we look at our COVID-19 admissions since the pandemic began, this last week was the second highest census we've experienced through the pandemic. Our IU Health South Central Region COVID-19 inpatient graphic shows that unvaccinated people continue to make up the majority of individuals who need hospitalization when they have COVID-19. As our state data reports, only about half of Hoosiers that are eligible to get their COVID-19 booster have done so, which could also be a contributing factor to those hospitalized, as Commissioner Caudill was saying, or as Administrator Caudill was saying. That's part of the reason why people are being hospitalized without that booster. Fully vaccinated means both doses and the booster. This high number of people were experiencing symptoms and testing positive is causing also our emergency departments across the state of Indiana to be very busy. Our South Central Region emergency departments are no exception. This one day, this past week, we surpassed our highest number of patients that we have ever had in our expanded emergency departments at our new IU Health Bloomington Hospital. That's a record for us. Thank goodness we have our new hospital, and it's larger, but it's overwhelming sometimes to see the numbers of patients that are going through there, many of them due to COVID symptoms. Therefore, we're continuing to ask that those with true emergencies and life-threatening concerns seek care with our emergency departments without question. And we also ask that those with more mild COVID symptoms or other non-emergent reasons seek care at our locations and our facilities that are aimed at less emergent care. So by choosing the level of care that best suits your healthcare needs, you can help by ensuring emergency department beds are readily available for those who truly need that level of care. And as we keep talking about boosters, even if we see declining numbers of COVID positive patients across the nation and our state in the coming weeks, we still have to remember that a significant decrease in the prevalence of this virus would still surpass previous levels of infection, hospitalizations, and deaths. And if this decrease is sustained for the next several weeks, the virus is still circulating and just as potent as it was on the climb up to these record pandemic levels. A decrease in numbers is just that. And when you compare it to the prevalence of the virus throughout the pandemic, it's still very significant. We have probably several weeks, even if we sustain this decline, that this prevalence will still make people very sick and cause hospitalizations and death. The World Health Organization has been a big part of the global fight against COVID-19, and this past Tuesday, whose COVID-19 technical lead cautioned that future mutations of the virus won't necessarily become milder strains. It's a hope, but there are no guarantees, which makes public safety precautions and getting fully vaccinated extremely important in the fight against the current Delta and Omicron variants. And so I just also, as Commissioner Thomas said, put a thank you out to our health department, IU, and all of those who are doing great things, our public administrators, the commissioners, all of those, the city, all of those that have had these mask mandates and the things that have kept us safe. If you look at Monroe County, how slowly we climbed to the red and how quickly through this pandemic we come out of red, you can see that Monroe County stands out among many counties in doing the right things for its citizens. By fully vaccination, I mean full dose regime and a booster shot. And the CDC just published a study last week showing that Pfizer's booster was actually 90% effective 14 days after administration. That's the one I received, and I am very pleased to say I have not tested positive throughout this whole COVID-19. So please get fully vaccinated as soon as you can. There are lots of opportunities that we've already heard about, and I know that IU is going to talk about, and I'm happy to take questions at the end.
Okay, let's next check in at IU, first with Aaron Carroll and then Kirk White.
Thanks, and as always, a pleasure to be here. And I'm trying not to repeat too much of what's been said already. We clearly know the surge continues. We hope we're getting to the peak of it and that it'll start to come down, but we're still very much within it. And what the same thing is occurring at IU. For our first week back, as expected, cases were higher than before. And as students began to mingle, our cases went up. But we have not been in exponential growth or in anything which would look like the surge in terms of numbers as the rest of the state. From week 2 to week 3, our cases remained somewhat consistent. And this week, we're waiting to see what happened. And when I'm talking about weeks, I'm talking about from Monday to the week of school versus what might be on the dashboard, which is more Wednesday to Wednesday. But regardless, we're doing a significant amount of testing. We've made it easier and easier to test. Therefore, when we do more testing, we do see more cases. Our positivity rate, however, has been reasonably consistent over the last 2 weeks, and we're waiting to see how this week turns out. But it's our hope that things start to peak as well and then start to come down. We're not really seeing much in the way of significant illness. We're not seeing anything that shows any big outbreak centers when we do contact tracing. And we're not seeing that anything in terms of class or many of the things that we worry about are where danger might lie. But we are part of Indiana, and it's impossible to escape a surge when it is occurring. We're part of the community, but we're going to continue to do all of the things we're doing, including giving out high quality masks, universal masking in public places, ubiquitous testing, drop-off testing. We're doing a fairly large amount of symptomatic testing on top of course, all the asymptomatic testing that we do, and we will continue to monitor and make adjustments as we need to.
Well, thank you, Dr. Carroll. And just to update a bit with our statistics, as Dr. Carroll mentioned, our dashboard does trace our infection rates from Wednesday to Wednesday. And as of the 26th of January, our total number on the Bloomington campus was 806. 710 of that is in our student population and 96 with our faculty and staff. But as Dr. Carroll mentioned, it's consistent with the rest of the community in the state. And we still believe that with our high vaccination rates, we're going to be able to continue to keep things on an even keel and not have as high a rate of serious infection, which is what we've exactly seen with the 95% vaccination rate. We did last week, were able to make available the KN95 masks for a higher level of protection. It took some work in our procurement department to find enough of those, but I'm happy to report that as of today, we've distributed over 4,000 KN95 masks on the Bloomington campus, and we'll continue to receive supplies and distribute those. If you'd like one, we're ramping up to be able to supply one per person per week. And you can pick those up at our COVID-19 testing site, which is at Gym 171 in the Public Health Hyper building. during their normal hours when they're doing the normal mitigation testing. Just drop in there. Our staff will be happy to hand you one, and you'll be in a little better shape using that best mask available wherever you happen to be at the time. As Administrator Caudill mentioned, we're really pleased about the number of clinics that we have available. In fact, today and tomorrow at Simon Scott Assembly Hall from noon till 8 p.m., we have a vaccine and booster clinic. Plenty of capacity over there. For a while, the state side did not list it as a booster site, but it is. For 18 and above, we'll be, in fact, as we speak, they are administering Moderna shots over there. You can get in and out in 10 minutes. Plenty of capacity and space today and tomorrow. So we look forward to seeing you there. And then next week, in cooperation with the county and the state's bringing another mobile team down. The 2nd through the 5th of February, again at our 800 North Indiana Avenue site, where we were a few weeks ago, from again Wednesday through Saturday of next week. That'll be both a testing site and a vaccination and booster site. So you can do both at that location. And we would appreciate registration ahead of time that you can do at coronavirus.in.gov. And then finally, I just say, as others have mentioned, for all of our staff that are providing essential services during this time, it is a challenge. It's a challenge for all of us to keep things running the way everyone would normally expect it to be. And the university is having some of those same challenges, just as the hospital and the city and the county are as well. We just ask everybody to be nimble and flexible. We've not had any significant service disruptions, but some reductions in service here and there as different members of our custodial staff or dining staff have had to take some time off. Others are able to come back. We've been able to keep things going, but I just want to say thanks to all those folks that are working so hard, and thanks to folks that are being patient as we all weather through this as best we can. Speaking of weather, it doesn't look too good out there right now. Thank you.
All right. Thanks very much. And we will get into media questions. Of course, you can submit those in the chat here as well. I want to start with one from Aaliyah Blackburn from Fox 59 in Indianapolis. I'm going to direct this at Aaron Carroll because this is a question that was asked during one of the Ask Aaron webinars recently, and I'm going to direct it your way. She asks about whether or not the cold weather can have an impact on those home testing kits that we're all going to be getting in the mail, if they are left in the mail for any length of time in outdoor weather, or just left in a car when it's really cold like it is today.
I think you definitely want to let them return to room temperature before you use them, because of course there's liquid in there. But as far as I know, nothing about them would be damaged by their being in the cold in transit. Of course, if you believe that somehow they've cracked or something has occurred to them, then I would not use them, and I would seek to get a different test. But in general, I don't think that there's been too much put out there that this is a concern from the government.
Okay. Another question, we're waiting on some more media questions. We had one that came in on our Facebook page that I'll ask, and Aaron, I may direct this your way as well. Wanting a comment on this, that Sweden has decided against recommending COVID vaccines for kids aged 5 to 11, the health agency said on Thursday, yesterday, arguing that the benefits did not outweigh the risks.
It's funny. I think my last column sort of focused on this. It depends on whether you're focusing on an individual or a population. It is very easy when we're talking about vaccination to argue that my risk is low, therefore I shouldn't do such a thing. This is often the argument for why parents will refuse measles vaccines or polio vaccines, saying what's the chance of my child getting measles? And if you want to look at it from that standpoint, then some people can make an argument. I'd still argue that the benefits are still larger than the risks, even at the individual level, but at least there could be an argument. But from a population level and trying to reach herd immunity and a level of immunity where this slows down and we don't keep transmitting this over and over again and seeing massive variants, we need huge numbers of people to get vaccinated. And as long as we have large numbers of the population, including children who are not immune and not vaccinated, this will continue to spread and reach levels where we're having outbreaks all of the time. So from a population level standpoint, I would argue that that's not the correct decision, that those children likely have loved ones who are at risk, whether they be grandparents or parents or people who are immunocompromised or may have cancer, or I could keep the list going on and on. But too much focusing, I think, on an individual and each person's individual risk misses the opportunity for us to do public good, which is often what vaccination is about.
Question from Holden Absher from WFIU WTIU for Mayor Hamilton. Of the 30 new city employee cases this week, is it known if any of them are linked to previous cases?
Thanks for the question. Not as far as I know. Our press release that we put out every Thursday goes through in quite detail each of the cases. I know generally these are we do check it, and I'm looking at this week's. There were no members of the general public identified as close contacts, and the vast majority are viewed as community contacts that we've seen. But I haven't gone through all 30, but the vast majority are new. They're individual new positive cases, and they're not related to each other in significant way. Again, it's really the community spread that's just showing up in our workforce like so many, I think.
This is from Dave Askins, the B Square Bulletin, again for Mayor Hamilton. Given the sheer number of city employees who have tested positive, it's a little surprising we haven't seen more interruptions in sanitation services like we did for 1 week a while back. That was when the numbers were nowhere near what they are now. Is the city taking some new and improved approach to covering shifts?
Well, thanks for asking, and it does give me a chance to thank our sanitation workers. Of course, our numbers depend upon where they are in our workforce: police, fire, sanitation, parks, water service, etc. But it is true, last week, our sanitation workers, including the head of the department, got on the back of the trucks to help. We lost about half of our employees on one period, and they actually just ran double shifts that day. They did a double circuit from what they usually did, worked longer, and that was a wonderful. We had some workers from the street department step up and say, I'll help that day. So we've seen wonderful collaboration and volunteering, and I know that's the case in so many workforces, and we appreciate that, and we haven't had service disruptions. But as Kirk said, and others, we really appreciate everyone's patience too, because this is challenging us a bit. But so far, our employees have done a wonderful job stepping up to try to make sure we got that kind of coverage.
Another question submitted on Facebook. It's directed to Penny, but Aaron, I'm going to ask you to comment on it as well. Is there any indication immunocompromised individuals should get a second booster?
Who do you want to take that?
Well,
Dr. Carroll.
Okay, I'm happy. All right,
Okay.
fine. So the CDC has said that severely immunocompromised people who there's a concern that they have not correctly made an immune response or have made a suboptimal immune response, or if on the advice of their healthcare provider, they believe they should get a fourth dose, they should get a fourth dose. Go. The CDC has authorized that, although there's been some confusion. I believe that has now trickled down to pharmacies. But we're talking about a small number of very immunocompromised people. This is not something broad that everyone should be making their own judgments. This would be something if you have pretty significant disease and have been in touch with your healthcare provider and have been specifically told that you should go do this, then a fourth booster may be warranted. But this is not a broad recommendation that would apply to most people.
Okay, I'm going to direct this one at you, Penny, here. This is a question that again came in from Facebook. Do we need to report positive results of an at-home test to be reflected with community numbers?
No, the at-home tests are not reportable. Now, the only time that they are really reportable, schools may take at-home tests in order to do follow-up with those. And they will enter those only into a specific school reporting database that they use. They are not counted in the dashboard.
Okay. I'll give it a moment. No other questions on the docket for the moment, so I'll give it a second. Again, remind you that for Indiana University, if you want more information, covid.iu.edu, and that has a lot of stuff, including the links to the Ask Aaron webinars that we do that cover a lot of general information as well as IU specific information regarding COVID. Seeing no other questions and seeing the snow getting heavier outside and sensing a need to shovel, we may leave it there and we'll call it a day for today. Everybody have a good weekend.
Thanks,
Thank you.
everybody.
Stay safe. Thank
Well,
you.
everyone.
Get vaccinated.